Women think a lot about whether they can get a hair transplant. Especially when it comes to hairline, a lot of young women come to get surgery. If it's the top of your head, worry about the surgery. Some people are asking if hair loss will continue, even if I get a hair transplant. In fact, for women, depending on the type of hair loss, you're going to decide whether to operate or not. Alopecia areata, in which hair falls out all the way to the back of the head, or, in cases such as alopecia totalis, surgery is not recommended. In cases such as general hereditary hair loss, surgery is fully possible. However, one thing to consider is that for women, hair loss does not progress by receding the hairline backward, but rather affects the crown area. Therefore, a larger amount is generally needed. That's why you need a lot of hair transplants. It's not just a single procedure. I have to plan for the surgery later. And there are quite a few hospitals that don't transplant hair on the top of the head, because the top of the head needs to be a lot like I said before. You have to be fast to plant a lot, and since I have hair before, I'll avoid it well in the meantime. You have to go in well, and it needs to be dense. It is more difficult than hairline surgery, because the engraftment rate must be high. However, female pattern baldness can be improved if surgery is performed at a hospital that is good at performing crown surgery.